I think we're ready to get started. Again, welcome to this week's office hours for ESG and ESG-CV. My name is Helena Emanalo, and I'm today's moderator. If you are just joining us, please go to the chat and introduce yourselves with your name and the region you represent. As a reminder, this office hours is being recorded for public record, and a copy of the slide deck and recording will be emailed to all attendees. Next slide, please. All questions must be submitted in the chat box. Please type your question into the chat box. The team will read questions out loud at the end of the presentation and provide answers throughout the presentation. All questions and answers entered into the chat box will be recorded as part of the public record. Alongside our presenters, we also have several HCD staff, including ESG representatives, ESG-CV grant administrators, and other consultants who are able to answer questions during the Q&A session. Next slide. Today's office hours session agenda includes the following: ESG and ESG-CV updates, office hours updates, upcoming trainings, ESG, ESG-CV Q&A, and our Spotlight series presentation, which for today is preparing for a COVID surge. And now I will hand it over to Tuesday for our ESG updates.
Tuesday, you're muted.
We can't hear you.
I told myself not to do that. Hi, I'm Tuesday Poole, and I'm going to be talking to you about ESG annual updates today. The 2022 NOFA application webinar and FAQs are for COC and BOS applications are up on our website. Look for them under the Notice of Funding tab. The NOFA applications are due August 17th of 2022. Now let's get those in. Next slide, please. This is where you can find our NOFA 2022 NOFA application webinar and our COC and BOS frequently asked questions on our website. Next page, next slide. As a reminder, our BOS standard agreements should have been executed no later. I'm in the wrong place. The 2020 grant expenditure deadline was July 17th. Please get your last RFF and certificate of completion into your representative no later than August 24th, so we can get those funded and the money's out to you. Next slide. The 2021 contracts, BOS standard agreements should be executed no later than the end of August. Reminder, all grantees have expenditure deadlines with this upcoming funding, and 20% of your grant needs to have been encumbered within 120 days of execution. Your grants manager will help you remember that deadline. Next slide, please. Reminder, the ESG webpage has resource section where you can find our policies on personally identifying information, homelessness prevention, match, HMIS, VAWA, and we now have a new street outreach policy. Take a look. Next page, please. Your annual performance reports should already be submitted. Next page, I'm sorry. Your annual performance report should already be submitted. This is a very important reporting requirement. Next slide. Next slide. This year's APR has 3 reporting workbooks. ESG projects were already due on July 1st. The APR and eligible cost workbooks were due on Monday. If you're having any difficulties, please reach out to your grants manager or the NOFA email box for assistance. Next slide. And this is your grants management team: Diane Prado, Giovanni Martinez, Sam Liu, Anthony Zapita, Tuesday Cool, me, and Sarah Theobald is our new program manager. Welcome her. Thank you.
Thank you so much, Tuesday. And now I have just a few ESG-CV updates and reminders. HCD is ready to begin amending ESG-CV contracts to extend the contract to December 31st, 2023. Email reminders were sent to those ESG-CV grantees whose expenditure deadline was July 30th, 2022. So once HCD receives your amendment request in eCivis, we will begin routing your contract amendment and extending your contract dates. Next slide, please. Oh, the next step will be for the subrecipients to submit a contract amendment in eCivis, and instructions on how to submit a contract amendment have been emailed to you by your grant administrator. So please reach out to your grant administrator if you need assistance. The new term of agreement and performance milestones are as follows. The agreement will expire on December 31st, 2023. All program funds must be expended by September 30th, 2023. All HMIS and admin costs must be expended by October 31st, 2023, and all final funds requests need to be submitted to the department by November 15th, 2023. Next slide, please. In accordance with HUD's expenditure deadlines, included in the CPD 2022-06 ESG-CV notice, grantees must meet the following expenditure deadlines for ESG funding. So that means that by January 31st, 2023, you must be 75% expended or more. The difference between the 75% of the total award and the amount drawn in IDIS as of January 31st, 2023 is the maximum recapture amount. Next slide, please. Some things to keep in mind. You cannot submit an RFF in eCivis after July 30th, 2022 if your current contract has an expenditure deadline date of July 30th, 2022. Once your contract amendment is executed, then you can submit your next RFF. And if you have any extenuating circumstances and need to submit an RFF while your contract amendment is being processed, you must inform your grant administrator and receive written approval from HCD. And you cannot submit an RFF with expenditures past your current expenditure date. So upcoming office hours topics. On August 10th, we'll have the invoice review clinic. August 17th is the ESG-CV outcome measures. August 24th is cultural humility. And August 31st is the COC clinic. Next slide, please. So the following trainings will be held throughout the month of August. On August 3rd, we'll have rent reasonableness and fair market rent. August 4th will be equal access rule, incorporating underrepresented perspectives. Also August 4th will be allyship and activism. And then August 11th will be becoming anti-racist in practice, leading with racial equity. So please review these trainings and to determine which sessions will be most beneficial to you and your colleagues. And as always, the links that you need to register can be found on this slide. Next slide, please. So this slide is the COVID response resources for standing up infection control measures and the CDC and NHCHC guidance. Next slide, please. And here we have the ESG resource links for your reference. Next slide, please. Any questions?
Helena, there was one question that I think was geared towards Sarah in the chat, so maybe we could have Sarah talk about that.
Good morning, everyone. There was a question in regards to repeating the 20% spent by August for your 2021 contracts. No, it is 20%. The 20% milestone expenditure deadline is within 120 days of execution of your 2021 contract. Back to you, Helena.
Thank you. Ben asked, could you please help clarify whether the 75% expenditure for ESG-CV is submitted in RFFs and paid out, i.e. drawn by HCD and IDIS?
So I can answer that, I think, for Ben. So the 75% expenditure deadline would come through the RFFs that you are submitting. And once you submit an RFF, it's typically drawn by HCD and IDIS within a few business days after that. So you'll be focusing on meeting that 75% by submitting RFFs in eService. Does that help answer your question, Ben?
Okay, any other questions? Okay. I will hand it over to Chris.
Thanks, Helena. And thank you all for joining us this morning for our office hours. And we're going to head into our spotlight presentation today. I know it's summer. I know it's hot. I know that in California, the fire season is just kicking up. But we're not really that far from thinking about what happens post-summer and preparing for the possibility of having congregate shelters reopen or open for the winter season, or having more folks in one spot to be sheltered. And we have to remember that we are still in a very delicate position in the pandemic itself, where we are still spreading this thing, this disease, to folks who are still at high risk, including a lot of our folks that are unhoused, and folks who might not have all the vaccines they need to avoid catastrophic results from this disease. So as such, we wanted to kind of just put it in front of you today that remember, we are still dealing with COVID, and there are still surges going on nationally. And we need to remember that all those things we've done the last 2 years aren't over. We still have some of those things we need to do. So we've asked our good friend, Ashley Kerr, to come and talk about preparing for a COVID surge. And I'm sure she'll meander through many of the topics that I've already set up so far to really help us to make sure that we keep our clients healthy, safe, and housed. Ashley?
Thanks so much, Chris. And thanks for giving a nice segue for the next slide as I talk about some community context. All right, I'm stating the obvious. It's still a major concern. We know that this has proved super unpredictable with the different variants that really cause infections and reinfections. We also know that there is limited interest right now in non-congregate shelter in many communities, and that your funding may have been may have run out and may be close to running out for non-congregate shelter. But we also know that isolation is really the primary way to mitigate the spread. So as Chris mentioned, winter is coming. It is actually right around the corner. I think I just made a quote from Game of Thrones, even though I did not watch it. And we also know that everyone is super tired and there are multiple competing demands. As Chris mentioned, the fire season has started. The COC NOFOs, I should say, plural, are out. And so everyone's just kind of fried. But just because everyone's fried doesn't mean we have to let down our guards. So let's talk about how we're going to prepare for our winter surge. Next slide, please. So if you only remember one thing, because your recall is limited, but only one thing from this presentation, it's that you need to know your community COVID-19 level. And CDC makes it really easy for you. You go in to the link, once this goes out, that you will be able to hyperlink to it. Once you go to this, you pick your state and your county, and it tells you your level. I'm just going to give you a heads up if you haven't done it yet today. I checked a bunch of California counties. They are all high. So the CDC puts it in the perspective of low, medium, and high level. High level means that you really need to be thinking about mitigation strategies. So masking is back in place. Some places it is being mandated, other places it's still voluntary, but masking should be in place regardless of vaccination status. That you need to consider implementing strategies for screening testing, especially when you are thinking about congregate spaces and settings. That you need to make sure that you are implementing your enhanced prevention measures if you are working in a congregate setting, and we're going to talk about that in just a moment. You need to be thinking about how you are continuing to distribute and administer vaccines and boosters. Some folks are, if they haven't gotten their first booster, are absolutely eligible for their first. Many folks are eligible for their second booster. So get people to the vaccine, get the vaccine to the people. And we'll talk about that also in just a couple of minutes. And then thinking about how you are always improving ventilation in public indoor spaces. So again, you do not have to be the expert here. You have public health and healthcare providers in your community who are the experts. So rely on them for the most up-to-date information in your particular community. Next slide, please. All right, I'm like a broken record here. Y'all know what works. Masking works, vaccines work. They both help mitigate the spread and reduce death and serious illness. So keep up the practice of masking regardless of vaccination status. Be able to communicate that to the folks that you are serving, and always provide consistent opportunities for access to the vaccines and the boosters. Also think about a few more things around infection control measures. Socially distance at 6 feet in congregate settings whenever possible. Maintain those non-congregate shelter options if at all possible, and especially for people who are at very high risk for serious illness. Think about maintaining and make sure you are implementing equitable pathways to both isolation and quarantine. So back to that non-congregate shelter I just mentioned. And always make sure that you are thinking about in testing strategies to use as an outbreak prevention measure. Next slide, please. So we know people are fried. You don't have to reinvent the wheel here. HUD put together a really comprehensive set of winter planning tools that you can access on the HUD Exchange website that really help communities think about a winter emergency response. So first, take whatever lessons learned that you got from last year's winter and include them in your planning process for this year's winter. Read the planning tools and guidance. I'm not going to go through them in their entirety because they're super comprehensive, and y'all can do that on your own. I'm just going to really hit some highlights here. But the thing that we really want you to think about is that you want to engage your critical partners. Think about who you engaged last year, and you will likely be including them again. Designing the plan to meet your cold winter sheltering needs. That's going to depend upon what is available in your community, both funding and facility-wise. And then, of course, implementing your infection control measures. And you're going to think about that in a variety of different ways. Next slide, please. And by the way, as I'm talking, if any of you have some great lessons learned from last year's winter, we would love for you to put them in the chat. All right, it's time to bring the band back together, because you need to have a variety of stakeholders at the table for winter planning. One, we want to talk about cross-sector, right? So this is municipal folks, emergency management, homeless service providers, faith communities, and healthcare. We want to make sure that those who are at the table are representative of your entire community. And I'm going to underline in bold the term entire. We want everyone at the table who can contact and connect with the variety of folks that you have in your community, and make sure that you're including people with lived experience. If folks were not included last year, that is okay. Bring them in this year. This is really the opportunity to continue to expand your network as you are talking about winter planning. And when you get this presentation, there's going to be a number of different stakeholders on the next slide that we are hiding for this particular presentation, but it will all be there for you in case you're like, who am I connecting with? So that will be a good resource for you. Next slide, please. Okay, as we think about designing a winter plan, it's all about contingency planning. So Plan A is your baseline. That's really your projected winter shelter needs that you are capable of with existing resources in your community. Plan B is a surge in demand. So we like to think about it in sort of 20%. So a 20% surge that really exceeds your typical winter capacity. This means that you are going to have to activate key partners in your community, including emergency management, to help you expand both spaces and staffing. And then Plan C is a significant surge. So that is more than 20%. This really extends beyond the homeless system's capacity, and it needs government support to meet the demand. So this is where you have all of your elected officials and municipality, jurisdictional folks at the table helping with addressing the surge in demand. And of course, your communities are going to have to determine what triggers the activations of plans B and C. Next slide, please. So I'm going to talk about estimating the needs on the next slide, but let's talk really quickly about shelter facilities and staffing. And right now, I think I'm really reiterating things that you already know and have already been doing, but I'm bringing it back to the forefront as you think about winter planning. So as we know, non-congregate shelter, best practice, but is probably not going to be available in large quantities due to a number of factors in your particular community. So the next best option is for communities to think about what large spaces you have and are available for safe congregate areas. So unused government buildings, decommissioned schools or gymnasiums, and I can give examples of that. Unused buildings that are owned by the faith community and or service provider community. We know in one community that the Salvation Army had some extra buildings, and one of those buildings was used as a COVID positive congregate shelter space in one of the communities that I worked in. I also know of a community that used a school that was a 2-level school, and the bottom was there for services and the top was there for isolation and quarantine space. Also think about nursing homes, dormitories, or seminary space, places where there are large opportunities or dormitory features. Also think about, places where people go for retreats that may not be as popular in the winter, but are super popular in the summer. That may be another place for you to consider for isolation and quarantine space. And then staffing. What is your best case scenario for your client to staff ratio? And then what is acceptable, right? We always want best case, but really right now with the significant staffing demands and not enough supply, we're looking at what is acceptable here. And I recognize that that is not a best practice, but we need to think about how we keep the doors open and how we serve people. So always think about that. And then who can supplement those teams? So temporary workers, contract workers, emergency management, volunteers, interns, thinking about how you can expand your existing team. Don't forget, of course, volunteer incentives, eligible expense under ESG-CV. Next slide, please. So let's talk a little bit about how you can estimate the need. And again, the winter planning guide goes through this step by step. I'm just really hitting the highlights here. It is really hard to predict the level of shelter demand that communities are going to face, but you have to use the data that you have to inform your planning efforts. So look at your winter shelter utilization for the last 3 years, along with considerations for both bed loss due to decompression and increases in people who are living unsheltered. When you use your real-time data along with your projections, this will help you right-size your winter plan. Really thinking about looking and using all of the data you have in your community, so coordinated entry data, looking at assessments, enrollments, and unsheltered numbers will really help you estimate the need going forward over the next few months. And again, it tells you how to do this in the winter planning guide. I just hit the highlights. Next slide, please. So there's another really good resource to think about, and this really comes at it from a sort of good, better, best approach. But there is something called Alternative Approaches to Isolation and Quarantine Spaces. This is a product on the HUD website. It talks about the different facilities and spaces to consider what are the attributes, really the pros and cons of those spaces, and then how you can fund those spaces. Next slide, please. Okay, here's the real big question. What happens if public health tells us that we have to shelter in place, right? We've been talking this whole time about, okay, use hotels and motels, use different congregate spaces, but the reality is going to be that some of these surges is going to have more demand for space than the supply exists. So in this case, you're going to need to think about sheltering in place. We have California communities that have already been doing this. What I want to say here is that you do not enter into this idea of sheltering in place lightly, and it is not a unilateral decision. This is really where your shelter and your COC and ESG providers are working together and are communicating with public health and emergency response to make the determination of whether or not you need to shelter in place. Next slide, please. So I worked on this product along with a colleague of mine. We used resources from Seattle, Los Angeles, San Francisco, and Chicago around how you would actually isolate in place. And what we mean by isolation in place, we'll see IP as well, is it's the practice of sheltering COVID positive folks or symptomatic individuals using private rooms or creating sectioning off spaces within your congregate setting because you're not able to take those folks off campus. And so you need to think about how you are isolating and quarantining people within a congregate setting. So this resource, again, read it. It's good. It has a lot of details and it shows, infographics, how you would do it, how you would cohort, basically asymptomatic and healthy versus symptomatic COVID positive, what that looks like in a congregate space. It talks about operationally how this would work and how you would move people, literally, how people move within a congregate setting when you have cohorting in place, and also what are those staffing considerations. I have linked to a PowerPoint that LA presented on office hours many months ago in HUD's office hours. That gives you a good indication of how they really thought about this. And LA is one of the communities that we used for consideration of developing this product. Again, it's detailed, read it, it's super helpful. But I just want to put that out there that you may need to think about this, especially if you're in a more populated area like LA, San Francisco, San Diego, Sacramento, and all of the other big cities in California. You may want to think about this, of course, as you just do your winter planning in general, but it's a really good product out there. Okay, I kind of burned through that stuff super quickly because I'm hoping that we have some space for conversation, lessons learned, and any questions that folks have. So I'm just going to open it up right now for that and see if there's been anything that came up. I saw Taylor's been putting all of the links in the chat, so really appreciate that, Taylor.
Thanks, Ashley. And as Ashley said, this is the point of time where we have our discussion. So feel free to come off mute, raise your hand, put something in the chat. We can also take the slides down, encourage you to join us on video. We're here for as long as y'all want to talk about preparing for any COVID surges you may have in your community. Maybe you're having one right now and you'd like to kind of talk through it. So.
I'd also just love to hear if anyone has some really good lessons learned from last year, because we always want to not reinvent the wheel. So if somebody did something that worked really well in your community, it would be great to share that with your fellow colleagues on the call.
I don't really have a lesson learned, but one thing you said, Ashley, that kind of resonated with something I'm seeing in some of my communities is that their non-congregate shelter funding is running out and they have no alternatives for funding sources to keep that going. So they've really been concerned that they're going to have to shut down their hotel programs, and I think communities are kind of scrambling for that. So I appreciate that you brought that up and mentioned that, the reality is we're probably going to have to figure out how to start addressing this in those congregate settings.
Yeah, absolutely. And, even if your funding isn't running out in a lot of other parts of the country, and I'm sure in some parts of California, it's really hard to find hotels and motels that will take folks because they have gone back up in their business and they have decided that this is not what they want to be, to partner with at this particular time. So the whole idea of really looking at alternate spaces is going to be key.
Yeah. Thanks, Aaron and Ashley. Melinda, I see your hand raised. Go ahead.
I was just going to say if anyone does have any stories or, suggestions from last year, because our program is new. And so this will be our first season, COVID season out, so any suggestions would really help us out.
Thanks, Melinda.
One of the things that I think, as I mentioned in one of the slides around engaging critical partners, is in all of the communities that I worked in last year and learned from, all of them had basically emergency management and or municipality jurisdictional folks at the table because they had to find large spaces, and they did not always have that within the homeless service system itself. And so while I mentioned Salvation Army often has a lot of buildings and that worked in one community, in most of the other communities, it was a church that had a very large auditorium or a church that had been shut down. So they had additional space. The schools that were decommissioned, other types of municipal or jurisdictional buildings that could be used for congregate space. And so it was a combination of emergency management and the homeless service system that basically cobbled together isolation and quarantine spaces for that particular community because the surges were happening and the shelters were not able to take people in to their existing facilities.
Thanks, Ashley. If anyone has any other advice for Melinda, please go ahead. I see something from Jasmine. Ashley, I'm going to ask you, and I was hoping this would come up without me having to prompt it, but it did. So New York declared monkeypox a public health emergency. Should areas in California look ahead to preparing for that in addition to COVID surges? We wonder if COVID surges will look different this upcoming season due to other viral, I'm going to just go with infections since that trailed off there. But what are your thoughts, or what is the scuttle you're hearing from HUD around monkeypox and how that might affect our plans for this year?
Yeah, so I'm just going to say I'm not a public health official. While I do have a degree in public health, like this is really something that you need to be looking at your local health officials for. There's some real concern around monkeypox for a couple of reasons. One, the virus has a longer incubation period right now than we've been seeing in COVID, and has a longer time in which people are contagious. We're looking at weeks, like 2 to 4 weeks, really depending on if there are active sort of sores or lesions on the body, and it's highly contagious. So the isolation time is going to be longer. I would really look to your public health officials to see what you all need to be doing. The other part that I have just been hearing, really, frankly, in the national news, is that people are having a hard time accessing the monkeypox vaccine. So to the extent that you can really help your community, not only if you're doing a vaccine clinic already and vaccines are coming, if COVID vaccines are coming to your shelter or other congregate space, ask if public health can also bring some monkeypox vaccine. I mean, it is out there. So, but we know that there's been some barriers to people getting to it because of any number of reasons. So to the extent that you can really help vaccinate against monkeypox, it's going to be really helpful for your community. But it is a real big issue. And I wish I had some better information on that, but you're going to have to think about, obviously, isolation for longer periods of time.
Right, and we were just talking about the funding constraints we already have for non-congregate shelter. This is only going to make things potentially that much worse. I have been thinking a lot recently, Ashley, and just love your thoughts on this, that we have seen the non-congregate shelter system be fairly successful, show pretty good results, not only from a health perspective, but also from a housing perspective, because as we close non-congregate shelters, we are actually putting folks in housing and not just returning them to the streets or other places. And I'm starting to see in my head that this long-term is potentially better than congregate shelter because of the trauma of putting folks together. And I think we talked about this in one of our other sessions on equal access rule or something, where, you know, putting folks in a shared space creates conflict. Putting folks in their own space reduces conflict. Obviously, it doesn't eliminate it, but it doesn't reduce it. So that means you have more time as a case manager to work towards the housing goals instead of the interpersonal things that take up a lot of time. So I just wondered if you had any reflections on that for yourself, because it's starting to show to me like, oh, this might be the way to do business, actually.
Yeah, and you're really teeing me up for the effective non-congregate shelter workshop series that will be coming in the fall or winter. I can't remember exactly when, but it is going to be coming. So yes, what I would say is, right, we have some preliminary information from Washington and from some other places that not only are people really taking care from the isolation space, right, and not and lessening the mitigation or mitigating the spread, but people's well-being has improved overall. Just the things that most of us take for granted, when we can use the restroom, when we can shower, when we can nap, when we can, frankly, just take a moment of quiet solitude to really have a moment for ourselves, it reduces trauma and really increases overall well-being. So I've really been thinking about sort of this entire time with ESG-CV, how you use this short-term funding to maximize long-term gains. So are there ways in which you, as a shelter, have been able to renovate so that more spaces feel more as non-congregate shelter than congregate, right? Like, can you increase the number of respite rooms? Can you increase, which can really be rooms that are for medical respite, or frankly could be detox rooms, you know, where people need to sleep it off, but basically like a sort of a space that is flexible. And, you know, have you been able to do that? What could that look like in your space? How have you been able to think about renovating or changing what your bathroom situation looks like, so that people have more opportunities for time alone in restroom facilities, right? And so I know that ESG-CV is winding down, but to the extent that you all can really think about how you take the non-congregate shelter approach and overlay it with congregate, you know, what can that look like going forward? How can you really change your facility? How can you better incorporate hotels and motels into your work in general, or other spaces like that? So I don't have the right 100% answer for everybody, other than this was really an opportunity to make some long-term gains in the shelter system, and we know it has worked. So how do we take that forward?
Yeah, I think the two things that I took from that are, you know, shelter as dignity, right? Having a little bit more compassion within our shelter system itself, but also the idea I put out there of non-congregate shelter is the way to go. It's expensive. It's more expensive in that intervention, but long-term probably less expensive as far as someone's, you know, use of the entire system. But we have congregate shelters and they do have budgets and they are going to continue to be around. So the idea of modifying them or bringing more dignity within the shelter itself is, I think, a great idea that you floated there, actually.
Yeah, and we have seen that people have taken advantage of this and they have increased the number of individual rooms, whether that means that that's where actually a family can go or some other household, or again, you can use it as flexible space so that if you are surging and you have to shelter in place, you can do some isolation and quarantine rooms in addition to the congregate space. So it's always about bringing dignity. It's always about serving people who are most vulnerable and most traumatized.
Yeah, I think about Jasmine's question as well around monkeypox, and we have COVID-19 is still very surging in many places. Flu season will be happening. We've had tuberculosis outbreaks in California before. When we have our congregate settings, there are lots of potential diseases that we have to really be concerned about. And I think that's, just saying COVID planning isn't enough any longer.
Yeah, I mean, what I will say is, and I mentioned it earlier, but when you host vaccine clinics, have them bring every single vaccine they can. So because you can get multiple vaccines at once. So get the COVID in one arm, get the flu in the other, right? I mean, whatever other vaccines. If you are doing it in a family shelter, it's a great opportunity to make sure that you have some of the vaccines for children that are available, and maybe they haven't been able to get to primary care, so they are not on their regimen. So, this is really an opportunity for preventive care in addition to acute care if people are COVID positive.
Thanks, Ashley. Appreciate that conversation. That was very, very great. Any additional questions, comments, things you'd like to talk through with Ashley and myself or your colleagues? Please use this moment to do so, or we will be ending about 15 minutes early.
Which may be what everybody needs right now on this hot August day.
With 2 COC NOFOs opened and the world of stress that we all are dealing with. So
yeah, 100%.
All right. Well, with that, I am going to go ahead and close us out today. Thank you, Ashley, for presenting on COVID-19. Thank you all for joining us. I want to thank the annual ESG team and the ESG-CV grant administrators for hosting and doing all the hard lifting, heavy lifting. We are back at it next week, so hopefully we will see you next Wednesday. Have a great rest of your week. Be well.